I didn't know that's the video that they were going to show, but it reminds me, Dr. Kane told me recently that there's a 15-year range from southern Hamilton County to downtown Indianapolis in terms of life expectancy. So the closer you get down through Center Township, the lower the life expectancy. So she certainly caught my attention with that number. The other thing I would say is that the Indy Hunger Network that Gleaners is part of has a goal of having a high-performing food pantry in every zip code in this city. We're getting there. If you guys know a good spot in Franklin Township, that's a glaring gap that we're all trying to pay attention to. But I'll go on to the remarks I actually had written for this morning. I want to share 3 questions to start that off and help us decide as a community as we're mobilizing limited resources to resolve what's really a daunting mix of interconnected challenges. The first one, hunger connects crime, education, health, and the economy. So is that intersection of food insecurity and health Indy's most urgent issue? Second, how are hunger, obesity, and chronic illness hurting Hoosier taxpayers, employers, and frankly, our shared future? Third, are we doing enough about the state of hunger and health, from federal programs at the large scale to local food pantries in neighborhoods? So a little bit of Gleaners so you have some context. We're a member of a national network of 200 food banks called Feeding America, that together is unfortunately the 3rd largest charity in this country. Those food banks support over 60,000 local agencies in neighborhoods in every county in this country. And Gleaners is the 2nd largest food bank facility in this country, after, not surprisingly, one in Texas, where all things are bigger. But frankly, when I think about that, I'm not proud, I'm not even enthused that we have the largest or 2nd largest food bank in India. Why do we need it? We shouldn't. We cover a 21 county region in central and southeast Indiana that's a mix of urban and rural and high population and high poverty counties. We're critically dependent on more than 20,000 donors and more than 32,000 volunteers each year. And our partners, from retailers to individuals, provide us with enough food for 24.2 million meals a year. If you translate that to a wholesale, that's over $50 million in food that we're sending out, and we're a fraction of what happens. The average poverty rate in our service area is 12.7%. That's 316,000 plus food insecure neighbors here in Indiana, and unfortunately over 100,000 of that number are children. If you translate that at the state level, there are 1 million food insecure Hoosiers, and our service area has about 1/3 of those. And the poverty rate in Marion County is exacerbated, it's over 20%. But I encourage you to think about hunger as a symptom of one or more inextricably intertwined challenges that face the families we serve. Hunger leads to or exacerbates other issues as well. So families in poverty are facing daily choices. It's awfully hard work to be poor. Hunger's a health issue that directly links to nutrition. It negatively impacts academic performance. I think we've all seen that through Indy Star's efforts and others. But also worker productivity, that we don't think about the hungry adults in the household, and a whole range of social issues, including crime. When you combine those, that's a substantial economic cost for every Indiana community. I'll give you a little background on the people we serve, not just from the hunger perspective. Nearly half are children or senior citizens. 1 in 5 is a veteran or active duty military. 64% of these households report at least one unemployed adult, not the stereotype of 100% unemployment. 70% are in poverty, and 53% are deep poverty, which means that family has less than $10,000 a year to get by on. 29% of households include grandparents raising their grandchildren. 78% choose between paying for food and medical care. 34% of those we serve have diabetes, and over half, I didn't know the first speaker would talk about this, but over half have heart disease. And the primary contributor to their having heart disease, I'm sure heredity and other things, but it's the quality and variety of the food they eat. 81% of them must choose between food and transportation, 77% between food and utilities, and 65% between food and a place to live. So the big factor that we also don't think about is the scale of the problem in total. I shared some Gleaners numbers, but what we don't really add up unless you're in this hunger relief space is 91% of all meals to those who are hungry come from 4 federal programs. So any substantive change to those programs would have a devastating impact on the nonprofit sector trying to do less than 10% of the meals for those families. SNAP alone, 67%. School lunches, 15%. Then you have TFAP and the WIC program. What that really means is SNAP contributes 17 times as many meals as those 25 million meals from Gleaners. A little scary when you wake up and think about it. So Gleaners has grown dramatically since 2010. That was sort of a benchmark year for us when the full effect of the 2008 downturn kicked in. We've doubled the number of meals distributed, more than doubled our fleet, quadrupled our distribution of fresh produce to 4 million pounds a year, but we use several $1 million in financial reserves, and this is the first year we've returned to financial stability. As one of 3 food banks, and by the way, the Indy Hunger Network partners are in a similar scenario. We stepped off on that journey of faith in 2010 together, so that includes Midwest, Second Helpings, Meals on Wheels, a whole group of us together. As one of 3 Indiana food banks with an on-site food pantry, we can demonstrate that best-in-class food service operating model and so on that we'd like to see in every zip code in our service area. And thanks to the generosity of St. Vincent Health, I think somebody from St. Vincent's here, we're adding an on-site free health clinic right next to our pantry in about a month. So, and we're very intrigued to see how that direct intersection of service to those clients will help. In what represents a dramatic increase in the scale of Gleaners operations, as well as the quality and variety of healthy, nutritious produce, Gleaners now operates one of 8 regional produce centers for the Feeding America Network, and we're supporting 39 regional food banks, including ourselves as a customer, in 7 Midwest states. So when that scales up, we're right now transitioning from a pilot phase to a full scale up. That'll add 25 million pounds a year of fresh produce on top of the 30 million of regular food that we're doing. For Gleaners, that means going from 4 million to 9 million pounds a year. And my fundraisers have to figure out how to get the extra money to actually buy that produce, or our share of it. So I want to close with 3 points of emphasis. First, I believe we must change our historical pattern in this community of intense focus on one challenge at a time to a new community dialogue that accepts the interconnected nature of these challenges, and we need to do it collaboratively and simultaneously. Otherwise, we're not moving people out of that line for hunger or standing in line for health care if we don't deal with the whole mix. Second, my fellow hunger relief leaders and I can't be the only ones who wake up in the morning and wonder how we'll feed 1 in 7 of our neighbors. All of you need to join us. The food we eat is critical to our health, and that's why hunger is responsible for $77.5 billion a year in additional medical costs. That translates to $1,800 per food insecure household. And third, if I've given you a sense of urgency and a desire to accept that call to action, please find a way to distribute time, talent, and of course resources to solving not all the challenges of poverty together, including hunger, health, education, employment, housing, crime, and more. Thank you.